6 health checkups seniors over 60 should avoid. They could harm you. Senior health tips. As we get older, we're often told that more medical testing means better health. But what if that isn't always true? For seniors over 60, some common health checkups, the ones your doctor might recommend every year without a second thought, can sometimes do more harm than good. These aren't rare, exotic tests. They're procedures millions of older adults undergo every year, often believing they're adding years to their life. In reality, the risks can quietly outweigh the benefits, leading to unnecessary anxiety, invasive follow-ups, and even harmful treatments for issues that might never have affected your quality of life. In today's video, we're going to uncover 6 specific health checkups you should think twice about. We'll look at what the latest medical research says, share real stories from seniors who faced serious complications, and explain safer, more balanced approaches that could protect both your health and your peace of mind. By the end, you'll know exactly which tests might not be worth the risk, and how to have an informed conversation with your doctor that keeps you in control of your health decisions. Number 6. Annual full-body CT scans without clear symptoms. For many seniors over 60, the idea of an annual full-body CT scan sounds reassuring. Let's check everything at once and make sure nothing is wrong. But the truth is, unless there's a specific medical reason, routine whole-body CT scanning can expose you to significant and unnecessary risks. A single CT scan can deliver a radiation dose equivalent to hundreds of chest X-rays, and repeated exposure over years may increase the risk of developing certain cancers. The concern is especially high for older adults, whose bodies may be more sensitive to radiation damage and who might already have undergone multiple scans in the past for other conditions. The real problem, though, is overdiagnosis, detecting tiny, harmless abnormalities that would never cause symptoms but can lead to anxiety, invasive follow-up biopsies, or even risky surgeries. One large study from the National Cancer Institute showed that aggressive screening in low-risk individuals often results in false positives, which in turn cause more harm than benefit. And while CT scans are incredibly valuable for diagnosing specific issues when symptoms are present, using them as a blanket annual checkup can backfire, turning a precaution into a health hazard. Better tip: if you're otherwise healthy and symptom-free, skip the yearly full-body CT instead. Discuss with your doctor whether targeted imaging for specific symptoms or risk factors is truly necessary. This way, you reduce unnecessary radiation exposure while still staying on top of real health concerns. Number 5. Unnecessary bone density scans for low-risk seniors. Bone density scans, also known as DEXA scans, are an important tool for detecting osteoporosis, especially in older adults. But here's the truth most people don't hear. If you're over 60, generally healthy, have no history of fractures, and no major risk factors like long-term steroid use, getting this scan too often can cause more harm than good. Many seniors are told to repeat the test every 1 or 2 years just to be safe, even when their last results were normal. The problem is that bones change very slowly, sometimes over decades, so retesting too frequently not only wastes money but can lead to misleading results. Small variations in machine calibration or technician technique can make it seem like your bone density has dropped, when in reality it hasn't, which can push doctors into prescribing strong osteoporosis drugs unnecessarily. These medications, such as bisphosphonates, come with their own risks: jawbone problems, digestive issues, and even rare but serious thigh bone fractures. Overdiagnosis here can lock patients into years of drug therapy that may never have been needed in the first place. Another often overlooked issue is the anxiety factor. I've spoken with seniors who received a borderline scan result and immediately changed their entire lifestyle out of fear. avoiding physical activities they once loved, which ironically made their bones weaker over time. A recent study in JAMA Internal Medicine found that, in low-risk seniors, bone density scans repeated within a 5-year window almost never changed clinical management in a meaningful way. In other words, the second or third scan rarely provided new information, but it often opened the door to unnecessary treatment. Better tip: if your first bone density scan after 60 shows normal results and you have no major risk factors, you can safely wait at least 5 years before retesting, sometimes even longer. Focus instead on proven bone health habits: regular, weight-bearing exercise, adequate calcium and vitamin D, and a balanced diet. This approach keeps your bones strong without the stress and side effects of overtreatment. Number 4. Routine PSA blood tests for prostate cancer without symptoms. The PSA test, which measures the level of prostate-specific antigen in the blood, has been a standard screening tool for decades. Many men over 60 are told to just get it checked every year as part of their regular blood work, even if they have no urinary problems, family history, or other warning signs. On the surface, it feels harmless. It's just a blood draw, right? But the hidden dangers come from what happens after the test. Elevated PSA levels don't always mean cancer. They can spike due to benign prostatic hyperplasia, BPH, infections, or even recent physical activity. Unfortunately, a single slightly high reading often triggers a cascade of follow-up tests, repeated blood work, ultrasounds, and in many cases, prostate biopsies. A biopsy might sound routine, but for older adults, it carries real risks: bleeding, infections, hospitalization, and in rare cases, life-threatening complications. The bigger concern is overtreatment. Many prostate cancers detected in older men grow so slowly that they would never cause symptoms during a man's natural lifespan. Yet, once cancer is found, the pressure to do something can lead to aggressive treatments like surgery or radiation, which can cause lasting side effects: urinary incontinence, erectile dysfunction, and chronic pain. A large U.S. Preventive Services Task Force review concluded that for men over 70, routine PSA screening often results in more harm than benefit, with no significant improvement in survival rates for most low-risk cases. Even the American Cancer Society now recommends against blanket PSA screening in older men without clear symptoms or higher risk factors. What's even more troubling is the psychological weight of a positive result. I've seen seniors sink into months of anxiety waiting for biopsy results or debating treatment options for cancers that might never have caused them harm. This emotional toll can affect sleep, appetite, and overall quality of life. A price far too high for a test that may not extend life expectancy in this age group. Better tip: if you're over 70 or even in your late 60s with no urinary symptoms and no strong family history of prostate cancer, discuss with your doctor whether PSA testing is really necessary. In many cases, a watchful waiting approach, monitoring symptoms, and only testing if something changes, protects you from unnecessary procedures while still keeping an eye on your health. Number 3. Routine colonoscopies after 75 without new risk factors. Colonoscopies have saved countless lives by detecting and removing precancerous polyps before they turn into colon cancer. For adults in their 50s, 60s, and early 70s, they remain one of the most powerful tools in preventive medicine. But beyond age 75, especially for those who have had consistently normal results in the past, the risks of the procedure can begin to outweigh the benefits. Many seniors don't realize that colonoscopies are not without danger. They require sedation, carry a risk of intestinal perforation, bleeding, and infection, and can lead to prolonged recovery times. These complications are rare in younger adults, but in older patients, frailty, slower healing, and the presence of other chronic conditions can make them much more serious. Another, often overlooked, Problem is the physical toll of preparation. The bowel cleansing process, usually involving strong laxatives and a day of fasting, can lead to dehydration, electrolyte imbalances, dizziness, and even dangerous falls in older adults. A 2021 study from the Annals of Internal Medicine found that while colonoscopies still detect cancer in seniors over 75, the number of procedures needed to prevent one death rises sharply with age, and the complication rate increases just as quickly. This means the net benefit starts to shrink, especially for those without new symptoms or family history changes. There's also the issue of incidental findings, small, slow-growing polyps that might never cause harm but trigger aggressive follow-up schedules leading to repeat procedures every year or two. For some seniors, this can become a cycle of constant medical intervention without meaningful improvement in life expectancy. One patient I spoke with had 3 colonoscopies between ages 76 and 80, each time for a tiny polyp that never progressed, yet each procedure left him exhausted for days and anxious for weeks. Better tip: if you've had normal colonoscopy results up to age 75 and have no new symptoms like unexplained bleeding, changes in bowel habits, or strong family history updates, talk to your doctor about whether continued screening is necessary. In many cases, switching to less invasive methods like stool-based tests can safely monitor your colon health without the risks and recovery burden of repeated colonoscopies. Number 2. Routine cardiac stress tests without symptoms. For many seniors over 60, especially those with a history of high blood pressure or cholesterol, the idea of getting a yearly treadmill stress test or nuclear stress test just to be safe sounds smart. After all, heart disease is still the leading cause of death in older adults, and catching it early seems like common sense. But here's the part most people don't hear. In symptom-free individuals, routine stress testing can open the door to a series of unnecessary and potentially risky interventions without actually improving long-term survival. These tests are designed to investigate specific symptoms: chest pain, shortness of breath, unexplained fatigue, not to be used as broad annual screenings in healthy, asymptomatic seniors. The risk comes from false positives. A borderline or abnormal result can be triggered by something as simple as a medication side effect, dehydration, or even an irregular heartbeat that isn't dangerous. But once the report says possible ischemia or suspicious changes, the next steps often involve advanced imaging, cardiac catheterization, or even preventive stenting procedures that carry real dangers, especially for older adults. Cardiac catheterization, for example, involves threading a tube through an artery into the heart, and while often life-saving in emergencies, it also poses risks of bleeding, stroke, infection, or artery damage when done unnecessarily. There's also the nuclear stress test variant, which uses a radioactive tracer to visualize blood flow to the heart. This exposes the body to radiation. And for seniors who may have already had multiple imaging studies over the years, the cumulative exposure is not trivial. A large meta-analysis published in the BMJ found that in asymptomatic seniors, routine stress testing rarely led to interventions that meaningfully extended life, but often led to surgeries and medications that reduced quality of life due to side effects. One 68-year-old patient I interviewed described how a single abnormal treadmill test, later proven to be a false alarm, resulted in 3 hospital stays, 2 invasive procedures, and months of recovery from complications, all for a heart that was ultimately fine. Better tip: if you're not experiencing chest discomfort, unexplained breathlessness, or other heart-related symptoms, skip the routine stress test. Focus instead on regular blood pressure checks, cholesterol management, daily movement, and a heart-healthy diet. If symptoms ever do arise, testing can be done quickly and effectively at that time, targeting the real problem without putting you through unnecessary procedures. Number 1. routine head MRI or CT for peace of mind without neurological symptoms. For seniors over 60, especially those who have experienced friends or relatives facing dementia, stroke, or brain tumors, the temptation to just check with a head MRI or CT scan can be strong. The idea sounds reasonable. Catch something early before it causes damage. But when there are no neurological symptoms such as sudden vision changes, unexplained weakness, severe headaches, memory decline, or balance problems, these scans can become a trap that leads to unnecessary fear, invasive follow-ups, and even harmful treatments. Head CTs, in particular, expose patients to significant radiation. And while do not use radiation, they often uncover harmless anomalies, tiny white spots, benign cysts, or age-related changes that have no impact on daily life. These incidental findings frequently trigger more scans, biopsies, or even surgeries that carry real risks, especially for older adults with slower healing and other chronic conditions. The psychological damage can be profound. Imagine being told, "We found something in your brain. It's probably nothing, but we need to investigate further." That single sentence can rob someone of months of peace, create sleepless nights, and strain family relationships. Many seniors undergo multiple follow-up MRs or even brain biopsies for findings that never would have affected their health. Invasive brain procedures carry risks of infection, bleeding, and in some cases, permanent cognitive changes. A 2020 study in neurology found that for older adults without symptoms, incidental brain findings were present in up to 35% of scans. But fewer than 3% led to interventions that improved outcomes, and many of those interventions introduced new problems. Financially unnecessary brain imaging can also be a heavy burden. Even with insurance, co-pays, and related specialist visits add up. And for fixed-income seniors, this can mean cutting back on essentials like better nutrition, exercise programs, or preventive dental care, ironically reducing overall health. The more subtle harm, however, is how these just-in-case scans shift attention away from proactive health measures that actually improve longevity and quality of life, toward an endless cycle of testing and medical anxiety. Better tip: if you have no neurological symptoms, skip the routine brain scans. Instead, focus on proven ways to protect brain health: regular cardiovascular exercise, a diet rich in omega-3 fatty acids, quality sleep, and cognitive activities, like learning new skills. If concerning symptoms ever appear, your doctor can order targeted imaging immediately, ensuring fast and appropriate care without the stress and risks of unnecessary scans. Here's the truth: modern medicine has given us incredible tools for diagnosing and treating disease. But just because a test exists doesn't mean it should be done, especially as we age. After 60, the balance between benefit and harm shifts. Our bodies recover more slowly, complications hit harder, and the emotional toll of false alarms can be just as damaging as the physical risks. Every one of the 6 checkups we've discussed today, from full-body CT scans to brain is done just in case, can save lives in the right situation. But when they're used as routine annual screenings without symptoms or higher risk factors, they often create more problems than they solve. And those problems aren't just medical. They can drain your energy, your finances, and your sense of independence. The most powerful step you can take for your health after 60 isn't chasing every possible test. It's making informed, individualized decisions. That means having honest conversations with your doctor about your personal risk profile, the true likelihood that a test will change your outcome, and the alternatives that might give you the same peace of mind with far fewer downsides. It means understanding the difference between proactive care and overtesting, and knowing that sometimes saying no to a test is an act of self-care, not neglect. Think about it. What if those hours spent prepping for a colonoscopy you didn't need were instead spent walking with friends, What if the money spent on an unnecessary MRI went toward a nutrition plan that truly protects your heart and brain? What if you could trade the anxiety of a suspicious lab result for the confidence of knowing your lifestyle choices are actively supporting your health? These are the trade-offs we rarely talk about, but they matter more than ever in the later decades of life. So here's my challenge to you. Look at your upcoming medical calendar and ask yourself, is each test on that list there because it's truly necessary for my situation, or because it's just what's always done? Then bring that list to your next appointment and have the conversation. You may be surprised by how many of those tests you can safely skip. You'll not only protect yourself from unnecessary harm, you'll reclaim time, energy, and peace of mind for the things that make life worth living. I want to hear from you. Have you ever had a medical test you later felt was unnecessary or even harmful? Share your story in the comments. Your experience might help someone else make a better decision. And if this video opened your eyes, please subscribe for more senior health tips that put your well-being, not just your test, results at the center of care.